Hey, this is Dorel Lazarus with the Sleep Coach Academy, and I wanted to take a look at a video of a great doctor that's putting out a lot of phenomenal content on sleep. This is Dr. Michael Breus, the sleep doctor, and he has a number of amazing videos, and by and large, I think he's doing a great service to the sleep community and really sharing a lot of valuable content that can help a lot of people out there. But I think, as I've mentioned in other videos in the past, a careful consumer and sleeper has to know how to filter out information and not use one-size-fits-all solutions. So what I'd like to do is dive in specifically to a video he has about falling back asleep and just kind of teach you how to read between the lines and how to take on information that can help you, but also to be able to think for yourself. So let's go ahead and let's dive right in.
Questions that I'm asked almost every day from my patients, believe it or not, isn't how can I fall asleep easier? It's more what happens if I wake up in the middle of the night? How can I get back to bed?
I also see that a lot. I see for a lot of people, the waking up too early, not being able to go back to bed is a very significant issue.
So first of all, a few things to understand. A lot of people turn to me and they say, you know what? I have a tendency to wake up somewhere between 2 and 3 o'clock in the morning. Turns out that's based on your biology. So when you're falling asleep, your core body temperature rises till about 10:30 at night. It hits a peak and then it begins to drop. That drop is a signal to your brain to release melatonin. Why is that important here? Because as your core body temperature keeps dropping, at some point, it's got to go back up. When it starts to go back up, you move into a lighter stage of sleep. Guess what time of night that usually is? Somewhere between 2 and 3 o'clock in the morning. So I want you to know and understand this is biology that's getting to you. Everybody wakes up at that time, just not everybody has difficulty falling back to sleep. Okay, you've got a little bit of difficulty falling back to sleep. What are you gonna do about that? I can tell you what you shouldn't do. First thing you shouldn't do is you shouldn't look at the clock. Now I know this is gonna be a tough thing to do because everybody looks at the clock and then they instantly do the mental math and they say, it's 3 o'clock now, I've got to get up at 6:30, sleep, 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 and they try to force themselves to sleep.
Okay, so Dr. Breus has given a piece of advice. Don't look at the clock, because if you look at the clock, you're going to start the mental math, and then you're going to start forcing yourselves to sleep. Now, I would definitely agree, both of those things to do to try to force sleep upon you and start calculating how many hours you have of sleep if you're prone to anxiety can be challenging. But I'll ask you, is it the clock that's really causing that, or the inner thought pattern that is the one that's catching you up? Meaning for most people, I would say if they don't have any sleep anxiety, I would say the vast majority of people looking at the clock is totally fine. It's really, do I know that looking at the clock causes a pattern of anxiety? For a lot of the clients I deal with, they say, look, I know what time it is internally. I have a very strong body clock. I know it's 2 in the morning. It doesn't matter whether I look at the clock. Or I've heard from some people that not looking at the clock is anxiety provoking. It's just comforting for me to know what time it is. I don't start ruminating about thought process. So I think any one of these generic pieces of advice really has to be filtered out in your experience. Is looking at the clock helpful or hurtful? And what can you do even if you are looking at the clock not to spiral down that process of catastrophization that he was speaking about? The clock is just the tip of the iceberg. The internal thought process and reaction is much more the important factor that you need to keep in mind.
Gonna be honest with you, sleep, it's a lot like love. The less you look for it, the more it shows up. What I mean by that is you can't try to make yourself sleep. In fact, the best thing that you can possibly do is relax. So
100% agree. You cannot force yourself to sleep, and the more you try to force yourself to sleep, the more frustrated you're gonna get. But that advice is just relax. For myself, when I was struggling with anxiety and people told me that, it was very triggering because anyone who's struggled with insomnia, anxiety, racing thoughts, you know you're trying desperately to relax, it's just not happening, right? There's an inner fear response that's going on, and the more that doctors tell you to relax, the more frustrated you're getting. So I'm very just wary about that piece of advice. Don't force yourself, but I think there's a lot that can be done internally to help correct that negative patterns that you find yourself stuck in.
So if you could, do me a favor and don't look at the clock. I'm not so foolish as to think that that's really gonna work with you because almost everybody looks at the clock. So let's talk about a couple of other things that are important for you to understand. Another thing is we've now learned about something called non-sleep deep rest. This is where you're lying in a position, it's dark, it's quiet, you're not moving. Turns out this is a bit rejuvenative. It's not exactly like sleep. About an hour of that is worth about 20 minutes of sleep. So don't worry if you're lying there and you're still not falling asleep. It's okay. You're getting some form of rejuvenation. And don't forget, we're trying to look at your anxiety here. We don't want your anxiety to increase in the middle of the night. We want the natural sleep process to be able to take over.
I would very much agree with that sentiment, meaning the idea that sleep is either binary, I'm either sleeping or not, succeeding or not, I think can be a thought process that people can get very stuck in, versus when we take the pressure off and we recognize my job is just to relax, to allow my body and mind to be in that place, in that zone of comfort, and when sleep comes, it's going to be good. And even if sleep doesn't come, the process is rejuvenative. I do believe that can be helpful. But let's see his next clip, and I think I'm going to differ with him on the following.
The other thing that you really need to understand, and this is an important metric, is in order to enter into a state of unconsciousness, you need a heart rate of 60 or below. That becomes very, very important, especially if you come back from going to the bathroom or you wake up in the middle of the night and you feel your heart rate is up.
So yes, biologically, Dr. Breus is 100% correct. In order to fall back asleep, you need your heart rate lower. What I think could be anxiety provoking for some people is that, okay, my job is now to lower my heart rate. My heart rate is too high. I can't get out of bed. Oh, my heart rate is going to jump. I woke up, my heart's racing. Why is your heart racing to begin with? Anytime we're talking about the input of your physiology, people who have an underlying anxiety can start thinking, okay, I have to somehow slow my heart down, versus realizing you can train yourself, you can train your mind to be resilient. Even if you have to get out of bed, even if the kids wake you up, even if you need to use a bathroom, you can easily and effortlessly go back to sleep. And so as opposed to harping on like, oh my gosh, I can't get out of bed because my heart rate is going to increase, that can be very triggering for people. And I think realizing that your heart rate can increase and then easily go back down is the right message.
Speaking of going to the bathroom, that might not be the best idea. I want to be clear about something. If you got to go to the bathroom, please go to the bathroom. But a lot of people, they wake up in the middle of the night and they say, well, maybe I'll see if I need to pee. This really isn't a great idea.
I think for a lot of the clients that I deal with, they're waking up frequently to go to the bathroom, sometimes every 1 or 2 hours. And this is one of the most challenging things that some of my clients experience, is that they're technically sleeping fine, but because of that urination throughout the night, they're waking up frequently and then oftentimes have a harder time going back to sleep. So I think there is a lot that can be done to prevent that frequent urination. And that's something that I spend a lot of time working with my clients as well.
Because remember, your heart rate needs to be below 60. So when you go from a lying position to a seated position to a standing position and you walk across your bedroom, guess what? Your heart rate is up. So if you don't have to go to the bathroom, don't go.
Like I said, I think worrying about your heart rate and like, oh my gosh, I can't get out of bed because of my heart rate is going to be too high, I think that can lead down the rabbit hole of obsessive thinking. Many of us have kids that are waking us up. Many people just, once you're up, the noise and this and that, you need to be able to train yourself that even with that heart rate up, go right back to bed and bounce through it and be resilient and flexible in your sleep. I think that's the best strategy.
Go. Now, if you get back to bed or you're in bed and you don't want to get up, we got to do something to lower that heart rate. My favorite technique is called 4-7-8 breathing. And what it does is it actually lowers your heart rate dramatically, actually below 60, which is exactly where we want it to be.
While I agree that breathing exercises can be very helpful for people when there is an underlying reason why they were up to begin with. Is it nightmares? Is it trauma? Is it anxiety about falling back to sleep? Again, that focus solely on the heart rate. Your heart rate will naturally go down when your body is ready to go to bed. You don't need to do anything to make your heart rate go down. And sometimes when people try again to control their body or even to control their breathing, that can be very challenging for people.
It's quite simple. You breathe in for a count of 4, you hold for a count of 7, and you breathe out for a count of 8.
Yes, 4-7-8 breathing can be very relaxing and can help de-stress and help wind down the body. But for people, again, who are dealing with a strong, anxious mind, being that obsessive about counting 4 and then counting 7 and counting 8 can actually be triggering and rile them up, as opposed to just being very flexible and loose with the breathing and thought process, I find is a better option for a lot of my clients.
I want to be clear, you don't push air in and out really hard. This is a gentle breath in, filling your lungs, holding, and then pushing all the air out. What this does is it dumps out excess carbon dioxide from your lungs, allows fresh air to come in. It means your heart doesn't have to work as hard.
I believe that's somewhat of a misnomer. I know, we spent time with Tess Graham, who's one of the leading breathing experts in the world, and this idea of breathing all of the carbon dioxide out. The reality is you want the oxygen and carbon dioxide to be in perfect balance. Trying to breathe all of the carbon dioxide out is actually going to have counterintuitive properties. Carbon dioxide is a natural muscle relaxant. Your heart rate will lower itself when oxygen and and carbon dioxide are a perfect balance. When you try to overbreathe all the carbon dioxide out, you're actually going to rile yourself up and prevent the onset of sleep. Plus, like I said, I think you want to be just doing things that feel natural, not type of breathing that feels labored and that feels artificial.
Which means it lowers your heart rate. That's kind of what we're looking for here. So when you wake up in the middle of the night, if you don't have to go to the bathroom and hopefully you didn't look at the clock, here's what I want you to do. Remember, there's non-sleep deep breaths, so you're still getting some level of rejuvenation, and you can do 4-7-8 breathing to allow your body to lower its heart rate and eventually get back to sleep. Now, one thing that people say to me is, well, Dr. Breus, what if I do 5, 6, 7 cycles and I don't fall asleep? Don't worry. Remember, number one, this isn't the only time you've ever stayed up all night long. And number two, lying there is still some level of...
So I think this is a line I hear from doctors a lot, and I think it's a little bit of kind of a consolation prize. Like, hey, it's okay if you don't go back to sleep, you can still lie there, and that's helpful. This isn't the only night. And while all those things are correct perspectives, and I believe can be helpful, I think for a lot of people, it's too little. For many of my clients, they know that they don't get, let's say they're up at 3 in the morning and they lie there for the next 3 hours. Yes, that's rejuvenating, but they know that it's not the same as sleep. They know if they're up at 3 in the morning, they're going to be tired, bombed, exhausted, their eyes are going to be burning, they're going to be irritable and grumpy the whole day. So simply trying to placate them and be like, oh yeah, that 3 in the morning thing, it's not a big deal. For many people who have struggled with sleep, it is a big deal. And so I find that you can't really lie to yourself. You can't say to yourself, oh, it's okay. And yes, he's correct. If this is only an occasional thing, then you're going to bounce back. But for many clients that come to me, they've experienced this day in and day out for weeks, months, or if not years. And therefore, it's a pattern that continues to haunt them. And therefore, the idea of trying to say like, you're really fine, I think can be very triggering and upsetting to people.
Rejuvenation. I do want to give people a few different troubleshooting tips just in case it's going for a little bit long. Number one, if you can avoid it, don't get up. A lot of people will get up, walk around the house, maybe move into a different room, even turn on a light, maybe pull out their phone or read a book. I'm really not for that. I really think lying in bed, as long as it's not too frustrating for you and you're doing that 4-7-8 breathing, is going to be a great idea. The other thing,
I would agree, but again, you have to know the context. For many people, lying in bed is agonizing. They're struggling. They're trying really hard to fall asleep. And therefore, by reading a book, by getting out of bed, by trying something different, it can break the negative energy they're holding on to. Not for everyone, but I've seen that be very effective. So again, you really have to know how to filter out the information and know how to apply it to your case.
To avoid, you might find yourself to think, well, I'm a little thirsty. Maybe I should go get a drink of water. It's probably not necessary. What I would rather you do, keep a glass of water, room temperature, by your bed. That way you can reach over, have a quick drink. And in the morning time, remember, I'm always asking you to drink a lot of water anyway. So go ahead when you wake up in the morning and drink that whole thing. Do me a favor. If you want to spend more time...
Okay, that was great, Dr. Breus. And again, I think he's putting out a lot of good content, but I think there are two important factors that he failed to miss. The big question I'm always asking is, why are you getting up at 2, 3 in the morning, or whenever you're getting up? The general sleep hygiene advice he gives is helpful, but I think for a lot of people, it's just not enough. Many people are dealing with severe rates of sleep apnea, and their sleep is fragmented and causing them to wake frequently throughout the night. That needs to be addressed. Many people are dealing with an overactive bladder or poor digestion that is causing their sleep to be thrown off. Many people have real physical biochemical imbalances. Maybe their melatonin production is shot. Maybe their cortisol is all over the place. Maybe the neurotransmitters are lacking. Maybe they're dealing with a candida overgrowth. There's a lot of things that can go into a poor night's sleep, and the generic sleep advice can be very frustrating for people when indeed there is a real biological imbalance going on in the body, and the generic advice can actually be hurtful for them and push them off from finding their real solution. So I think this was a phenomenal video. I think he's doing great work, but like I said, you as the individual have to know how to filter that information out and find a sleep program and expert that really speaks your language and enables you to get to the root of whatever your sleep issue has been. If you're dealing with a long-term complex sleep issue and you're interested in setting up a free consultation, I would love to learn more about it. I will include a link below. And if not, stay tuned for our next video, everything sleep related here at the Sleep Coach Academy. This has been Dorel Lazarus, and I look forward to seeing you on the inside.